They have maintained a lot of activities for their residents here, particularly with respect to outdoor activities like golf. And I remember Gary Lester, we were talking very early, and he's like, we're not going to be allowed to play golf. I'm like, no, you guys need to do that, because I think what they did from the beginning is they said, okay, we understand the risk. We want to take appropriate action to mitigate the risk, but we want to do that in a way that's sustainable for our residents. And so I think that they've done that, and that's a combination of the community and the individual residents really being committed to that. But I think if you look at the demographics of this community and then compare the COVID outcomes, I think that they have done far better than what I think most people would have predicted, just given the basic realities of the disease. And so my hat's off to folks throughout the villages. My hat's off to the people here at UF Health Villages Hospital, because I think it's
We were listening to some of the update there in Florida. I want to take you to a live event that is happening. Just came up on our feeds right now. The Louisiana governor talking about the storm damage from last week's hurricane.
From outside the state, not crews, crewmen. So 17,000 individuals who are from out of the state of Louisiana who are working in our state to restore power. As those crews complete their work in different parts of the state, they will be collapsing onto the southwest Louisiana area. The National Guard remains fully activated with just under 6,200 guardsmen activated in support of Hurricane Laura recovery efforts. They have distributed more than 1.3 million liters of water, almost 800,000 MREs, more than 100,000 bags of ice, and almost 20,000 tarps to the citizens of Louisiana as of this morning. Today, they are operating 32 points of distribution throughout 20 parishes. And I want to remind individuals out there, if you want to know where the closest point of distribution is to you and what hours it's going to be operational, please contact your Office of Emergency Preparedness. They have that information. All of this work is being done in coordination with the local Office of Emergency Preparedness. So you can get that contact information for your Office of Emergency Preparedness at getagameplan.org. So we ask you that you would do that. As of this morning, we have more than 10,000 evacuees in non-congregant shelters. And basically, we're talking about hotels. That's 10,057 evacuees, 43 hotels, 32 of which are in New Orleans. We also have more than 4,000 evacuees in Texas hotels. And those are being sponsored by the state of Texas, and we really appreciate the help that they're providing to our citizens. There are still individuals who are determining that their homes are not safe, habitable, and secure, and need to evacuate and find shelter. And so I want to report that the reception center has moved from Zephyr Field in New Orleans, and we're now going to use the mega shelter in Alexandria as the reception center for individuals to register, and we'll work very hard to find them rooms. If it is necessary for them to stay at the shelter itself, we're going to make that stay just as short as possible, because we are trying not to do congregant sheltering because of the COVID public health emergency that we're currently working as well. So the reception center is now at the mega shelter in Alexandria. That's where individuals need to go to be placed in non-congregant shelter as rooms become available. Our folks at GOSEP are working around the clock, literally around the clock, to identify more hotel rooms and get contracts with those hotels. So you're to go there. Don't go to Zephyr Field, and don't go straight to a hotel. That's not going to work for you. Make sure that you go to the mega shelter in Alexandria. At this time, the Department of Children and Family Services is not issuing hotel vouchers. Instead, they are registering evacuees for placement in hotel rooms where we have space that has been contracted. If you need shelter or information, text LA Shelter to 898-211. LA Shelter to 898-211, and you'll get information. We want to continue to remind those individuals who've been impacted by Hurricane Laura, they can register for DSNAP now. This is the SNAP benefits, and that way you're already in the system when DSNAP becomes available for their communities. You go to dcfs.la.gov/DSNAP. dcfs.la.gov/DSNAP. Once DSNAP opens, this will obviously speed your receipt of these benefits. DCFS has upgraded its system, so even if you've registered for previous disasters, you do need to register again, unless you are a SNAP beneficiary already. If so, you do not need to register. Disaster benefits will be automatic for you. We do plan to open DSNAP on September the 10th. If that date changes, we will certainly let you know. I'm going to ask John Spain to come up here in just a second to talk about the Southwest Louisiana Community Foundation. But I did have a nice conversation today with the CEO of the American Red Cross, Gail McGovern. They are doing tremendous work in Louisiana. They are running some small congregant shelters, such as at the Rapides Coliseum, but they're also working the non-congregant shelters, and they're going to be taking over the management and operation of our sheltering at various hotels over the coming days. And so they're doing that. They've got commodity distribution going on and food service going on. She told me today they're serving 33,000 meals a day in Louisiana. So I do want to encourage people to consider a generous donation to the American Red Cross, and you can go to redcross.org/donate/hurricane-laura-donations. Seemed like they could come up with a shorter way to do that. But go to redcross.org, and I'm sure you can find your way to the donation button that will come to Laura. But it's redcross.org/donate/hurricane-laura-donations. So for more on donating and where it can go and the good that it's done with those donations, I'm going to ask John Spain to come up and give you more details.
Thank you very much, Governor. My name is John Spain. I'm the Executive Vice President for the Baton Rouge Area Foundation. And I want to make very, very clear that we're here to raise money for the foundation of Southwest Louisiana. That's Lake Charles. Obviously, their homes are among those that were damaged. Their staff is not capable of doing some of this work. The staff that is actually housed in our offices in Baton Rouge. So I'm here on behalf of our colleagues from Lake Charles to make an appeal for funds and donations to be made that go back into the community of Southwest Louisiana. Community foundations raise money and put it back almost immediately into those communities, standing up local nonprofits and organizations that can do the work before the federal and state money actually flows. There is a gap where private money has to be made available to help people who are hurting in the hours and days immediately after the disaster. We've done this after Katrina, after the 2016 flood, and it's imperative that you listen to your neighbors who are hurting in Southwest Louisiana. To make a donation to the Community Foundation of Lake Charles, this one is simple. It's one word: Foundation SWLA.org. SWLA stands for Southwest Louisiana. Foundation SWLA.org. If you want to send it to the Baton Rouge Area Foundation, every penny that goes to the Baton Rouge Area Foundation goes to Lake Charles. But the word is FoundationSWLA.org. We will actually start making grants this afternoon to nonprofits. As I speak here today, the mayor and parish president of Lake Charles are on a link to the members of the Community Foundation of Lake Charles at our offices in Baton Rouge, along with a half dozen nonprofits who are telling us what's going on the ground and making the case for the money they will need. Please reach out and help your neighbors in this time of need. please send what you can. I'm pleased to tell you that the Verizon Corporation this morning donated $500,000. Over 1,000 individuals have now donated money in the last 24 hours for a total of almost $300,000 from 1,000 donors. Whether you send $1, $5, or your company or corporation wants to do something larger, all of these dollars go back into Southwest Louisiana to help the people who live there and who need this immediate assistance. So thank you on behalf of that. Be generous. Think about your neighbors. Finally, the word one more time is foundation, swla.org. And Governor, thank you for the time. We appreciate it.
Thank you, John. And yesterday I had an opportunity to have a call with the CEO of Cheniere, LNG, and they committed $500,000 to the foundation as well. And so I know that's coming. So I do encourage people to give generously if you're able to do so. Later today, in fact, in about 35 minutes, I have a call with the White House Coronavirus Task Force. We did receive the most recent state-specific information and recommendations. And as we've told you, we've had some encouraging news of late with respect to COVID in Louisiana. We're certainly doing better than we were a month and 5 and 6 weeks ago. We are now yellow and not red as a state as it relates to cases. We do have about 15 parishes, however, that remain red, either for case growth being more than 100 per 100,000 population over 7 days, or because they have a percent positivity that exceeds 10. So the 10% level is still exceeded in a number of our parishes. But overall, we are doing better, and I want to thank the people of Louisiana for that. The restrictions, the mitigation measures are working here. And I will tell you that certainly, just like we've seen progress before and then we then spiked again, that can happen, but it won't happen as long as we are doing what we're supposed to do, and that is wearing our masks, keeping 6 feet apart from people not in our immediate household, washing your hands frequently, staying home when you're sick, and reducing your activity. Now, the problem is Hurricane Laura has made all of that more difficult, right? And we know that. The other problem is Hurricane Laura has really reduced our ability over the last week or so to do robust community testing. And so at a time when I would want more testing than ever, both to gauge what's happening because of Hurricane Laura, but also because we know we resumed our K-12 schools and higher education over the last couple of weeks, we really are at a low point in our community testing. Now, having said that, today, and they're doing just tremendous work across our state, the National Guard did stand up 17 community testing sites. But when you get to the numbers that we're reporting today, you will see that that's the lowest number of test results that we've reported in a 24-hour period in a very, very long time. And so we don't like that. The White House is still recommending that based on where we are, that we continue with the mask mandate and the closure of bars to on-premises consumption. We are reporting today 324 new COVID cases. And again, that's only on 4,029 tests. We were routinely reporting 15,000, 20,000, 25,000 tests a day. We need to get back to those numbers. We also had 19 new deaths for a total of 4,787. And then also today we're reporting a decline in the number of patients admitted across the state of Louisiana to our hospitals for COVID-19. And so we had the last 2 reports with small increases. Today we had a decrease. And so basically over the last 4 or 5 days we are flat, which is relatively good news. For updates about Hurricane Laura response or other important information, text Laura to 67283. We also have a new web page created with updates and resources. It's going to continue to be updated every day. That website is hurricanelaura.la.gov. Every day we're going to be making some progress. It'll be imperceptible to some, and they won't feel it. Not everybody, every day, but we're going to be making progress. But this is going to be a very difficult storm to recover from. It's going to take some time, especially in the most impacted areas of southwest Louisiana, because the damage was so extensive and so catastrophic. But I'm thankful that we have tremendous federal partners and local partners, that we have tremendous private sector entities, nonprofits, the faith-based community, and of course, state agencies that we've been talking about for a number of days now. So we're going to continue to work hard. I ask the people to donate if they can, to help their neighbor, and to lift one another up in prayer. And with that, I'm going to take a question. Yes, ma'am.
Governor, are you confident FEMA will have enough money to fund hurricane recovery without shortening the amount of time?
Yeah. Yeah, well, I am, and it's a good question. The question's about FEMA and whether they're going to have enough funds in the disaster relief fund. You know that by executive action, the president made $44 billion out of that fund available for lost wage assistance. So the fund was at $69 billion, and what he said was we're not going to draw it below $25 billion, so we would have the opportunity to respond to natural disasters. So FEMA will have that $25 billion. Now, there are other natural disasters going on right now, principally the fires in California. But my conversations with the FEMA administrator yesterday led me to believe that we're not going to have any challenges. And of course, we know that Congress is going to have to at least pass a continuing resolution in the near future to keep government open. We know that there's pressure building to pass some more legislation dealing with the coronavirus. So all of those are opportunities for them to pass appropriations for additional funds into the disaster relief fund too. But whether they do that or not, and I hope they do, we anticipate that the current fund balance will be sufficient for us here in Louisiana. But we're mindful we're still in hurricane season, and additional storms could happen. We're thankful that the weather report today showed that the systems that we've been monitoring, none of those are likely to have any impact on Louisiana. I think there might have been a brand new system that came off the coast of Africa today, but that's so far away. We don't know, but given the luck that we've had lately, we shouldn't count against it, right? Yes, sir.
Thousands of homes are still without water at this point. Can you describe the scope of the water problem and then explain to what extent poor water infrastructure prior to the storm is responsible for some of the issues that we've seen after Hurricane Laura?
First of all, the water problems are extremely challenging and widespread. The good news is that most of our water systems are coming back online because they were knocked off only because they lost power. And as power is restored, which is happening pretty quickly in central and north Louisiana, those systems come back online, subject to a boil advisory, because when water systems lose pressure, they no longer can be considered safe without boiling before you would consume the water. Now, as for the remainder, we know that both from a power perspective, it's going to be longer to try to get those systems up and running. But we also know that the destructiveness of the storm that did so much damage to the power infrastructure also damaged the water systems themselves. And quite frankly, we don't know the degree to which it was the storm or pre-existing problems that we're dealing with, but there's going to have to be a full assessment of the needs of each water system that was damaged, and to get those back up and running. But you know, we've been talking about water infrastructure in Louisiana for a long time now, especially in rural Louisiana. And I'm not going to pretend that our water systems were where we wanted them to be before the storm happened. But for example, some of these wells and treatment plants and distribution lines were already teetering, but others were in pretty good shape until the storm happened and caused damage to the systems. uprooted trees that ruptured distribution lines and that sort of thing. And I don't know the mix. I don't know, so we've got a long way to go in order to restore the water. I can tell you we're working with our local partners, whether it's a municipally owned system or something that's a water district of a parish or whatever, to try to make sure they have the resources that they need. Principally, they look like generators right now, but in addition to that, we know that there are some water systems that are going to require extensive work. And what we're trying to do is get that work done as soon as possible. And there are going to be some water systems across the state where they're going to do the bare minimum necessary to get the water operating again as soon as possible and continue to make the permanent repairs on an ongoing basis. But each water system is different, and we're engaging a number of contractors with expertise in this area to go in and assist with the assessments and the work, and we'll have more details for you about this later. Yes, sir?
COVID-19, apparently the state's going to be reporting once a week on all the college positive cases as opposed to individual campuses. And as you know, local school districts are pretty much on their own as far as how they report it. Are you generally okay with how K-12 and higher education is basically providing a snapshot of what's happening?
Yeah, well, we've done a lot of work with the K through 12 system, working through Kate Brumley, our superintendent of education, as well as with Kim Hunter-Reid, the commissioner of higher education, in order to work with them on ways that we're going to do testing, surveillance testing, and so forth, and then the capturing of the data and the reporting of that. And so it's my understanding that at the state level, we're going to be putting that data into the reports that we issue. But for the most specific granular type reporting, if you're looking at higher ed, you're going to go to the higher ed systems. And if you're looking at K through 12, you're going to go to the K through 12 systems. We did an awful lot of work, and that seemed to us to be the best arrangement that we could come up with. Yes, ma'am.
The mayor of Lafayette has indicated that they are not going to shelter in any hurricane evacuees there, and his administration suggested that those shelters should be set up in that area. Do you have concerns about how he has handled the response to evacuees, since he is one of the closest sort of municipal areas, large municipal areas that could have handled the evacuees?
Well, first of all, I appreciate the question. I don't know whether Mayor President Guillory in Lafayette is referring to congregant shelters, which we don't want to run congregant shelters either. Perhaps for a different reason, but if there's no conflict, there's no conflict. We don't want to do congregant shelters any more than is absolutely necessary, which is why I said when people report to the mega shelter in Alexandria, we are hoping that we're going to be able to register them and send them to a hotel room right away. If for some reason we can't do that, we want their time in that shelter to be as brief as possible before we can get them into a non-congregant shelter, a hotel room. Now, it's also my understanding that when the state of Louisiana attempted to contract with hotels in the Lafayette area for non-congregant sheltering for our evacuees, there were not rooms to be had. And so as far as I know right now, there are not going to be shelters in Lafayette one way or the other. And we do know that it's not just the evacuees looking for hotel rooms right now. Those 17,000 workers coming in here to restore power, they all need lodging too. And so we're all competing for the same resources. So I'm going to decline to comment on whether I think he's handling things correct or not, because quite frankly, my plate has been full, and I don't know the degree to which he's experienced the issues that he referenced when he made those statements and so forth. But as it turns out, Lafayette currently is not a candidate for non-congregant sheltering because we're not doing that anywhere. And it's not a candidate it's not a candidate for congregate sheltering because we're not doing that anywhere. And it's not a candidate for the other sheltering because they just don't have the rooms. I'll come back to you in just a moment.
Do you all have a timeline for how long you can house people in the hotels?
Till the money runs out. No, so there are different programs, and I don't have a FEMA representative here, and so I can describe it generally speaking. We think that we can do it on the initial basis of our contracts for about 30 days. But once that's over, we can transition to a TSA program where we would be issuing vouchers. Now, what we're going to try to do in the interim is make sure that the hotels that are currently participating under the contract program will also accept the vouchers, so that this is seamless from the perspective of the evacuee. We don't want to be moving people that we're sheltering any more than is absolutely necessary. But we will transition from the GOSEP issued contract to the TSA voucher, and we don't really know how long that's going to last, but it could last quite a while, because the options that you have in order to bring people closer to home look like travel trailers, manufactured housing units that you get from FEMA, and then you have to have the infrastructure to support those. So if I had 10,000 today, I can't use them because I don't have power and water and sewer and so forth. And so all of this is going to have to be staged. We're going to have a lot of different components to our housing plan. But I can tell you, the Blue Roof program is part of this. Our hotels are going to be part of this. We're going to be looking for apartment buildings that maybe have space available. It really is. We're going to try to carve together a lot of different options and make it work. But we should be using, and I believe we will be using, our hotels for an extended period of time. And by the way, that's not a bad thing for our hotels, because it isn't like we're hitting on all cylinders with tourism and conventions, and nobody is in COVID. And that really sort of is a blessing here. Because if our hotels had been full, I don't know where we would have put these individuals other than in congregant sheltering. And I'm nervous as it is about all of the movement that we've had in the state of Louisiana because of our preparations for, our response to, and now our recovery from Hurricane Laura. And we know that every time people are moving around, coming into contact with one another, the transmission of the virus increases. So we're really concerned about that. So we'll do the last question here. That was your question? Okay, look, thank you. I do appreciate everyone continuing to cover the public health emergency with COVID, the natural disaster with Laura. And I'm going to ask the people of Louisiana to continue to do what we always do, and that's be good neighbors, and to make sure that you help out where possible. Just do it from 6 feet away while wearing a mask, and let's lift one another up in prayer. And we will be back with you all tomorrow. Christina, what time? We plan to do it at 2 o'clock, and I will see you then. Thank you.
All right, everybody, good afternoon. Happy Monday. Thank you so much for watching News Now from Fox. Pilar Arias here. I hope you had a great weekend. Remember, if you want to see what I was up to, all you have to do is find me on social media, Facebook and Instagram. Just search Pilar News Now. I'm going to take you straight out to the state of Wisconsin, where Dr. Deborah Birx is holding a roundtable, COVID-19 related, no doubt. So let's listen in, because she's speaking directly to the media.
Both the university students who have returned to campus, as well as the local population. I think we also see your restaurants and your hotels really abiding by the state and local ordinances. We think this is a very positive piece. We have found that retail is very important within the mask mandates, because it's that requirement of masks that reminds people every day how important it is, and how important it is to protect one another. My big take home from this particular state has really been seeing the level of partnership between the different private sector and public sector entities. And I think that's part of the secret sauce in Wisconsin, is your ability to work together as a team. So to every person in Wisconsin, really, we know how to stop the spread of this virus. Wear a mask, socially distance. And what do I mean by that? It means you avoid crowds and you avoid creating crowds. Creating crowds in your backyard over Labor Day really needs to be avoided. Try to limit your barbecues to your immediate family. And remember, you could unnecessarily and unintentionally spread the virus to others by not wearing a mask, being under 6 feet, and being with your extended family. We know that's how many of the outbreaks are occurring across the United States. We feel fine, so we bring our grandparents and aunts and uncles together to share food and drink together, and unknowingly we pass the virus along with our love and our care for each other unintentionally. And so really, as we go into Labor Day, really protect those in your family. Really ensure that if you want to visit grandma, you're wearing a mask, you stay 6 feet apart. And anybody, frankly, that has a comorbidity, really work together to protect them and really keep social distance and wear a mask. And I think together we can stop the spread now. We can stop the spread as university students come back. And to every university student, please help us protect one another. If you have gone to a large gathering, if you have gone to, let's say, a fraternity house, and there was a party and people didn't have masks on, more than likely you became exposed to the virus. Please go and get tested. Please do not go home and spread the virus to your mom or your dad or your aunts and your uncles over Labor Day weekend. Please, if you do go home, wear a mask and protect them. Assume that you got exposed on campus and go back and protect each other, because together we can stop the spread of this virus. So I just really, again, want to thank the people of Wisconsin who have been working together. It's very clear that both the public and private sector have been working closely together to stop the spread of this virus. So I'm happy to take questions.
Wisconsin's mask requirement has been challenged in court. If it were to be knocked down, would we have worse health outcomes?
We know that the states, and I want to be very clear, the reason we have made the progress we have across the South, and so not only is this the governor's report, but every week in that governor's report, we put out a very clear map of the United States where new cases are happening. You can see a month ago, we had a lot of cases across the South. These Southern governors and leaders together put in mask mandates, increased social distancing, decreased occupancy in restaurants, and now, just 4 weeks later, they've dramatically decreased their number of cases. If we ever needed an evidence base of what these mitigation efforts can do when we work together, this is the evidence base. It's no longer theoretic. If we mitigate together as a community, we can stop the spread of this virus. And people continue to go on vacation. People continue to eat out. People continue to shop. But they wore a mask, and they didn't social gather in crowds. And so I think now we have a really not only a theoretic idea about masks because of the physics of it, we have a real public health illustration of how critical masks are in preventing the spread.
Dr. Birx, as you travel and you learn what different states are doing and kind of where they're at with mitigating the spread of the virus, once we get into flu season, does that kind of just change everything? Is that a concern for you?
Well, we have the power to have it not change everything, because what we're seeing in the Southern Hemisphere is when you use those straightforward, common sense, social distancing, avoiding crowds, wearing a mask, protecting one another, then we have seen less flu also. So this is our way together to make it through the fall together as we work together to that time when we have an effective vaccine.
The Washington Post today reported that the White House is considering a herd immunity strategy. What are your thoughts on that? What do you personally think of a herd immunity strategy?
You know, the president does like to hear from scientists across the United States, and I think you know that one of the scientists that really believes in herd immunity is in the White House, and we have very open and transparent and vigorous discussions about what that means. To me, and I've made this very clear, and to your farmers out there, you know what happens with herd immunity. that was created because there are certain viruses for which there isn't a vaccine among herds, and you let it move through that herd, and you accept a level of mortality of your piglets, of your ducks, of your chickens, of your cows, and then there's protection in that herd. So, and then you don't have it reoccur. I don't think anyone in the United States, including the president, was willing to accept that level of mortality among the individuals of Americans that we know are at higher risk for that. Even today, our case fatality rate in people over 70 has gone dramatically down, from almost 30 down to 7. But it's at 7. 7 per 100 cases. Whose 7 would that be? Your grandmother? My parents in a multi-generational household? So I think behind that number are true Americans that we have to protect. And although we've done a much better job in protecting those in vulnerable situations like nursing homes, and we've surged PPE and tests, and we know that that's a really important population and we're protecting them. There's another 80 to 100 million Americans with those same comorbidities that are in communities. And so we really want, the way to protect them in their communities is to decrease the spread in that community.
None of the University of Wisconsin campuses are testing students before they return to campus. Is that unwise in your estimation?
We had a great conversation with President Tommy Thompson that, of course, I know from being secretary during President Bush's administration, and I think he has taken a very serious and public health approach to this. He's testing the students here. He has a plan for surveillance testing. He has a plan for surge testing. And I think more importantly, or equally importantly, he has a plan for caring for students who become positive. He's arranged for COVID-specific areas within dormitories. He's arranged for nursing care. And so I think he's not only planned to find the cases, but also care for those cases. And so I think that's a very forward-leaning way to really address potential spread in universities.
The CDC recently changed its guidance to say that people in close contact with people with COVID don't necessarily need to be tested unless they have symptoms. Do you agree with that change?
I think what the controversy about the guidance is we probably should have ordered it differently, because that was really about if you've been exposed to someone, assume that you're positive and protect one another. It should have started with, this is how we think you should do surveillance testing to really find those asymptomatic individuals. That's on page 3, and so not everyone read through all the pages. I think the CDC right now is reordering that guidance, making it clear that when you have an outbreak, we want to ensure that those who need immediate diagnostic testing get it first so they can get the treatment that they need. And then also we want surveillance testing ongoing. And so it talks about public health testing. And so being exposed is both part of our surveillance testing and public health testing. And I think we really want to make sure that both of those situations are happening. That's what Wisconsin is doing. They're doing testing in nursing homes and testing at the college campuses, looking for those asymptomatic cases. That is a different issue than diagnostic testing and really ensuring that you can diagnose and find individuals. So Dr. Redfield is working on making that guidance more clear.
But just really quickly, the example you gave about a frat house, wouldn't the CDC suggest people who attended the party don't necessarily need to be tested?
No, because they said if you were, again, you have been exposed, that would be knowing someone was positive in the frat house, and then everybody would be quarantined and protected. What we're saying, if you have one of those parties and you've gone to them, even before you know someone is positive, you really need to be protecting those vulnerable individuals, both as students, faculty, community, and in your own personal household.
Just real quick, you mentioned that you were happy to see how widespread the mask usage is here in the area, but we still have many groups that are vehemently against mask usage. Now, we are seeing more and more people, more and more vaccines start being tested and stuff. With so many people being so against masks, when a vaccine comes out, is there a concern that we're not going to get enough people to be getting the vaccine?
Well, I think the mask issue is, I think it's really important for all of us to explain that there's strong scientific evidence about how the mask blocks respiratory particles. But there's also strong public health now implementation evidence that when you take this together, now I can't tell you what did mask alone do compared to other mitigations because we're doing those collectively across the South. You know, we're reducing indoor dining and we're providing social distancing. So we did both social distancing plus masks. And that has had a tremendous impact in decreasing the number of cases. And I think that has, through an understanding of really explaining to people why and why this is important. If you just tell communities without explaining to them why it's important, I can see why there is reticence. And there is particularly reticence, you can imagine, across the South in rural communities because they saw COVID as an urban problem. You know, something happens when there's lots of people together. That's something that happened in New York City or Detroit or Chicago. That's not something that would happen here in my small town of 1,200 people. But I can tell you what we saw across the South. It came to the small towns of 1,200 people. And so rural towns are not immune to this virus. This virus is highly transmittable. And whether you're in a small town in rural America or a big urban city, we have seen this virus come to you. And what we're saying to Wisconsin and across the United States where they have not seen this level of outbreak that we have seen across the South, that we have the ability now to protect each other and still have our personal freedoms of going out. It involves wearing a mask.
Dr. Birx, here in Wisconsin, K-12 schools, many of them are going to start tomorrow. Some of them, all virtual, some of them a hybrid or in person. Do you, I know it's hard to look into the future, but I mean, do you foresee anything happening in the way of schools that especially do start in person? Do you think they'll have to close? Or do you have any tips for them to make sure that they don't have an outbreak?
Schools are strictly a reflection of the community. Both the teachers and students come from the community. The best way to protect schools is for the community together to stop the spread of the virus. We know that's possible. And so if every community socially distanced, wears the mask, avoids crowded places, they don't have the big Labor Day backyard barbecues, they don't have those big gatherings in their backyard or in their living rooms, and they really use this time to ensure that they stop the spread in their communities, schools are just a reflection of the community. So the way to decrease the number of cases in schools is to decrease the number of cases in the community.
Do you think schools shouldn't hold in-person classes to start off the school year, or do you think it's okay if they do?
Well, each state has recommendations, and each school district has recommendations. What the CDC has done is provided generalized recommendations of how to protect one another within a school situation. And I think those are quite clear. Now they need to be executed so that we can see the public health value of those. When we went across the South, there were many people that called for all those southern states to close down. We had modeled how you keep open and still bring down cases. And what we were able to show is that happened. And so this is what the CDC has done. They have laid out a pathway to staying open. And I think what we're waiting to see and what the CDC is collecting information on is how that works school by school, school district by school district. The one thing I've learned over the last 6 months is when you don't have complete data, there are many opinions. And everybody's opinion is important when you don't have data. Once you have data, you can tier those opinions as this one's supported by data and this one isn't. And I think what I've learned in really meeting with governors and health officials, I may argue my position, but until the southern ability to control the virus, it was theoretic. Some of the governors across the South felt that they understood their population, which they did, and they also understood that where they were having trouble is after 10 or 11 o'clock when 20 to 30 somethings really congregate in bars. And so they restricted hours rather than closing the bars, and they've also brought down their cases. So I think this is really, we shouldn't make presumptions always that this isn't going to work or this is going to work. We need to really look at the data that comes from those different types of mitigation and really understand. And of course, if it wasn't working, we would be talking to the governor and saying, you know, you need to do more.
Last question, folks.
All good?
I was going to ask about the University of Washington IHME model, which you're familiar with and rely on, projects 317,000 deaths nationally and 2,340 in Wisconsin by December 1st. Do you think, what do you make of those projections?
Well, I think what they also say, and let me just say we don't rely on one model. I find it's each modeler, just like we talk about people with opinions, each modeler brings in different assumptions. And so we look at about 15 different models to really understand, because each of them bring value. And this one brings value. But he also makes it very clear that we can change our future. And what I've now realized in being able to see across the South, we can change our future. And if we wear masks and we socially distance and we don't create these home gathering events or neighborhood gathering events, we can protect one another and we can stop this spread where there's a really difficult, and I understand why it's confusing to the American people. In some people, there's really no evidence of disease, and in some people, there's extraordinary serious disease and a fatal outcome. And by looking at a person, you can't determine what their outcome is going to be, because you don't know what comorbidities they have. You don't know if they have type 1 diabetes and have had that since 5 years old. You don't know that. And so we have to make the assumption that we have to protect everyone, and now we know how to do it. So in that model, he also says, if we wear masks, we change our future. If we socially distance, if we respect one another enough to make sure that there's that space and that mask and that ability to not gather in our homes, because we're finding a lot of the new spreading events are happening in neighborhoods and homes as people get together. And I think that's our Labor Day message to Wisconsin. Please don't do that this Labor Day and this fall. Let's protect one another as we move forward the fall and until we get a vaccine. Thank you very much. Really appreciate being in your state. It's been such a privilege to interact with your health officials, your leadership, and critically to see that partnership between the public sector and the private sector, and really how much Wisconsins care for one another. I can understand why I see high mask usage. Thank you.
Again, everybody, that's Dr. Deborah Birx there. She participated in a COVID-19 roundtable in Wisconsin, and she definitely answered some media questions afterwards. Pilar Arias here with you. Happy Monday again. Thank you so much for watching News Now from Fox. I'm going to take you out to, well, we've actually got several different live updates happening. We've got Connecticut, we've got Los Angeles County, and we've got Mississippi, all beginning of the week COVID-19 updates. So since Los Angeles just started, I'm going to take you out there now, here on News Now.
Overcome serious challenges. To assist them during this time, the county is providing additional resources and extra support. The LA COVID Fund provides grants between $5,000 and $25,000 for small businesses, micro-entrepreneurs, chambers of commerce, nonprofits, with almost $100 million total allocated. The fourth round opens today and will last through this week. Once you apply, you will remain in the system for future rounds and will not need to submit another application. For more information on the fund and to apply, please visit LA Regional COVID Fund website at lacovidfund.org. Again, lacovidfund.org. In addition, we are working hard with community groups to support vulnerable residents. Providence, Southern California recently donated $1 million to meet the mental and physical health needs of people experiencing homelessness. Providence is partnering with the public and private organizations to expand services during COVID-19. The funding, in addition to an earlier $1 million contribution, will enable access to on-site health care at Project Room Key locations in the San Fernando Valley, which reserves hotel rooms as temporary housing solution for those that are experiencing homelessness. Across Los Angeles County, 16 nonprofit community-based organizations will receive grants to provide health services at our Project Room Key sites. This is another positive example of the way public and private organizations are joining forces to support our communities during COVID. With that, I would like to invite Dr. Davis up to give you the weekly count. Thank you.
Thank you, Supervisor Barger, and to the entire Board of Supervisors. Our county continues to move in the right direction in slowing the spread of COVID-19, thanks in large part to your leadership. Thank you for joining me today. I want to acknowledge first off that today is International Overdose Awareness Day. For anyone who is struggling with substance abuse, please know there is help available. You can call the Substance Abuse Service Helpline at 1-844-804-7500 to be connected to help. And I also want to acknowledge all of those who are working with those who have substance use. We thank you for your service. I want to talk today about the new framework that was released by the state and how it impacts Los Angeles County and our process for reopening. I also want to talk a little about what we talked about last week, and that is learning from our recent past and taking action that will prevent spikes in cases, hospitalizations, and deaths, especially as the Labor Day weekend approaches. Let's show the first slide. On Friday at midday, the state announced a new tiered framework to more easily communicate the extent of community transmission in counties across the state. This slide shows a summary of the state's tiers, the indicators they are tracking, and how counties are being classified as having either widespread, substantial, moderate, or minimal spread of COVID-19 virus in their communities. They will use this tier system to guide possible sector reopenings for each county to consider. However, the ultimate decision about sector reopenings will remain under the purview of the county health officer orders that are developed in consultation with our Board of Supervisors. If we can go to the next slide. Los Angeles County is currently in Tier 1, meaning that there continues to be widespread transmission of the virus in the county. Per the state, our current number of 7-day average cases, new cases per day per 100,000 is 13. This is nearly double the threshold for moving up to Tier 2, which requires that we have less than 7 new cases per day per 100,000 population. And even though the county's current test positivity rate of 5% puts us in Tier 2, red, for this metric, when the two metrics fall in different tiers, the state places counties in the most restrictive tier. Hence, Los Angeles County, like most counties in California, has been placed in Tier 1. Our path forward for recovery depends on us being able to reduce community transmission significantly so children and teachers can get back to their classrooms and more people can get back to their jobs with as much safety as possible. To put into perspective our progress in slowing the spread of COVID-19 across our communities, it's helpful to look at the trends line since April. If we can go to the next slide. This graph shows the 7-day number of cases per 100,000 people from April 1st through April 28th. As you can see, in early April, when all businesses except those that were essential were closed, we saw about 400 new cases a day, increasing to about 1,000 cases later in the month. A few weeks after businesses reopened, coinciding with the Memorial Day and July 4th holidays, we saw a rapid increase in cases, rising to over 3,000 new cases a day in mid-July. Since implementing additional modifications, including moving many activities outdoors and increasing compliance activities at work sites, we have seen that the number of new cases dropped to an average of 1,200 this week, or this past week. While this is good news, we're still seeing a ways to go in terms of too many new cases indicative of widespread. Let's go to the next slide. As we often mention, the test positivity rate is another good indicator of how we're doing at slowing the spread of the virus. In April, our test positivity rate was high at 15% because we were limiting testing to only people who had symptoms and were in high-risk groups. However, testing became far more available over the next couple of months, and our positivity rate dropped to about 5% in May. Unfortunately, by mid-July, after reopenings and holidays, where we saw many people in crowds, the positivity rate increased quickly and peaked at 9.5%. This month, we have seen a return to the test positivity rates we were seeing at their lowest point in late May. On August 22nd, the positivity rate in Los Angeles County was 5%. Again, this is good news, but we're still seeing way too many cases indicative of widespread. If we can go to the next slide. Hospitalizations have increased and decreased in relationship to cases. In early April, during Safer at Home, daily hospitalizations were at about 1,000 cases. Surges in hospitalizations happened twice, once in early May and then again in mid-July, when hospitalizations reached their highest levels on July 22nd, with about 2,200 people being hospitalized. Currently, there are about 1,100 hospitalizations per day, which indicates a significant decline. In addition to a reduction in cases, two other factors may contribute to the decline. First, the fact that there are now younger patients that we're seeing in terms of cases, and there's actually improved treatments for treating COVID-19. Next slide, please. Tragically, as we've seen cases and hospitalizations increase, we also saw an increase in deaths. In early April, daily deaths averaged about 11 per day. As we can see, the number of deaths increased significantly following outbreaks at nursing facilities in mid-April and May, and then again following our case and hospitalizations peaks in mid-July. Although recently deaths have been declining, currently an average of 29 people lose their life each day in LA County to this devastating virus. As we approach the Labor Day weekend and as we plan how our county will reopen schools and more businesses, we must look at the lessons learned from our experiences these past 7 months. In order for transmission rates to continue to fall, workers need to be protected the entire time they're at work. Our most vulnerable residents in nursing homes need to be safe, and we need to continue to forego our traditional holiday traditions. We know for sure that our holiday gatherings, parties, and cookouts can result in increases in transmissions, hospitalizations, and deaths. The ability for us to reopen more fully relies on everyone doing their part, being smart of their choices, and reducing their risk to exposure of COVID-19 every day. Next, I'll briefly touch upon the trends that we're seeing in skilled nursing facilities. As we consider our approach to reopening, we must consider how people who are most vulnerable to serious illness and death are doing. Since the beginning of the pandemic, people who are 65 and older have been more likely to be hospitalized with COVID-19 when compared to younger people, and sadly have been more likely to die from the disease. Next slide. Across the county, skilled nursing facilities, assisted living facilities, and other congregate housing for elders were sites for early COVID-19 outbreaks, and this was true in LA County as well. In this slide, the green line is all the deaths in LA County, and the blue line is the skilled nursing facility associated deaths. This slide shows a steep climb in COVID-19 deaths among skilled nursing facility residents that peaked in early May and has seen a downward trend since then. It also shows that even though there was a second wave of increased deaths in late July and early August, skilled nursing facility residents have seen no such increase. Instead, skilled nursing facility residents made up only a quarter to a third of daily reported deaths since mid-July. Now I turn to our recovery metrics with a focus on health equity. All along, we have been reporting on data by race and ethnicity and area of poverty. We do this because too often the burden of disease is carried unfairly by people of color and of low-income individuals. If we are explicit about these disproportionate impacts, then we can tailor our response to address them. As we return to lower case rates, hospitalizations, and deaths in the county, and are looking towards reopening schools and businesses, we want to make sure that these improvements are shared by all residents in the county. As you've seen since early on in the pandemic, our communities of color and those in low-income communities are bearing the brunt of the virus, both in terms of infections as well as deaths. We continue to talk about this because the recovery journey won't be complete until we close the gaps, while at the same time improving health outcomes for all. Next slide. This slide is the daily age-adjusted rate of cases by race and ethnicity. The yellow line on top represents the Latino, Latina, or Latinx residents of the county. Just below that is the green line representing Black residents. White residents are represented by the orange line and Asian residents by the blue line. This slide very clearly shows the disproportionate impact of COVID-19 infections among Latino or Latinx residents, particularly through the month of July. However, we also see that this rate has been dropping since mid-July. This is good news. Last week, we saw that Latinx rates at the lowest point since the end of May, and we're hopeful that we will continue to see this downward trend in transmission. If we can go to the next slide. This slide shows the daily cumulative rate by area of poverty. In this slide, the orange line on top represents residents who live in areas with the highest rates of poverty. These residents have had the highest case rates since the beginning of the pandemic and continue to suffer the greatest disease burden compared to all other income groups. By comparison, people who live in areas with the lowest rates of poverty experience less than half the cases when compared to those who live in the highest rate of poverty. Next slide. This slide shows the age-adjusted hospitalization rates by race and ethnicity in the county. Similar to the slide for cases by race and ethnicity, Latino or Latina or Latinx residents, shown here in the yellow line, represent or experienced a steep increase in hospitalizations in July, which had fallen back to pre-June levels by mid-August. Now, Latino, Latina, or Latinx residents have a hospitalization rate that is almost 4 times higher than that of Asian residents, who are shown in blue, and have the lowest rate of hospitalizations in the county. Just below the yellow line is the green line representing Black residents, who did not see the peak in hospitalizations, but have maintained a hospitalization rate that is more than 2 times that of both white and Asian residents. If we can go to the next slide. This slide shows us trends as we relate to deaths in racial and ethnic groups. Again, Latino or Latinx residents, sadly, have also been more likely to die of COVID-19 than other racial or ethnic groups. This chart shows deaths through August 22nd. It shows a steep decline in deaths among Latino or Latinx residents since early August. Again, we're hopeful that this trend will continue. Other racial and ethnic groups have fluctuated over the same period. We see daily deaths among Black residents, shown here in the green line, declining steadily since mid-July. Asian residents, shown in the blue line, increased slightly in July and early August, but seem to have declined again. And the orange line, which represents white residents, has consistently been lower than other racial and ethnic groups. If we can go to the next slide. Finally, I want to highlight the impact of poverty on deaths. Just as case rates are highest for those living in high poverty areas, so tragically are the death rates. This graph shows that individuals who live in areas with the highest rates of poverty, the orange line, have consistently experienced the highest rates of death. Those who live in the poorest areas of the county have a death rate that is more than 4 times that of those in wealthier areas of the county, shown here in the blue line. Today, we're sad to report additional 16 deaths today. 8 of those who died are over the age of 80, and 7 who passed away had underlying health conditions. 2 of those people who died are between the ages of 65 to 79, and 2 who passed away had underlying health conditions. 4 people who died are between the ages of 50 and 64, and 1 of those people had underlying health conditions. 2 of the people who died are between the ages of 30 and 49, and 1 of these people had underlying health conditions. This brings the total deaths to 5,784 in Los Angeles County. Our sincere condolences go out to everyone who is grieving a loved one or a friend who has passed away from COVID-19. Our thoughts are with you as always. 93% of the persons who died from COVID-19 had underlying health conditions. Again, I caution you, that means that 7% were healthy or did not have an underlying health condition. For the 5,443 people who passed away where race and ethnicity were identified, 51% are Latino, Latinx, 24% are white, 15% are Asian, 10% are Black, and less than 1% are Native Hawaiian or Pacific Islander, and 1% identified as another race or ethnicity. Today, we're reporting 1,022 new cases. This brings the total number of cases in Los Angeles County to 241,768. These cases include 10,492 cases reported by our partners in the city of Long Beach and 2,368 cases reported by the city of Pasadena, which have independent city health departments. We're reporting 1,583 confirmed cases among people experiencing homelessness. Among these cases, 441 were referred to isolation and quarantine sites to appropriately isolate for the duration of their illness. 1,043 confirmed cases are currently hospitalized. 33% of these people are confirmed cases in the ICU or the intensive care unit, and 19% are on ventilators. We have investigated a total of 1,608 residential congregate settings and non-residential settings with at least one confirmed case of COVID-19. Of these, 825 are being currently investigated, and 783 are closed investigations. Residential settings include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, and correctional facilities. Non-residential settings include workplace, food and retail, and educational settings. The total confirmed cases in institutional settings is 32,107, including both staff and residents. 16,364 of these confirmed cases are residents, and 15,743 are staff. We are sad to report that 2,597 residents in institutional settings have died from COVID-19. 2,346 of these people who died in institutional settings resided in skilled nursing facilities. Of the 16 newly reported deaths today, 19% were skilled nursing facility associated deaths. Again, our hearts are with those, everyone who is grieving a loved one or a friend who were lost to COVID-19. Again, we are so sorry for your loss. We are reporting 3,555 confirmed cases at some point in jail facilities, 3,153 among people who are incarcerated, and 402 among staff. There are 243 cases in the state prison, 183 among people who are incarcerated, and 60 among staff. There are 758 cases in the federal prison, 742 among people who are incarcerated, and 16 among staff. And 142 cases in the juvenile facilities, 60 among youth, and 82 among staff. Almost 2.3 million people have been tested and had results reported in Los Angeles County, and our positivity rate for all of those tests remains at 10%. In closing, as we're coming up on Labor Day weekend, I want to share with you tips for celebrating as safely as possible. It's likely going to be a hot weekend, so be sure to take precautions to avoid the hottest part of the day and keep cool. First, only gather with members of your household this holiday weekend. There is so much more to do together in our beautiful county. Explore a trail or have a picnic at one of our beautiful beaches early in the day. If you're outside of your home and around others, please wear a face covering. Always use your own utensils, cups, food, and drinks, and do not share with others. Avoid crowds and be flexible and willing to change plans or move to a different location if you find yourself in a crowded area. And once again, avoid confined spaces, especially places where you can't stay more than 3 steps away from others if that's not possible and others aren't wearing face covering. And if you're sick and have been exposed to someone who is positive for COVID-19, please stay at home, isolate, and quarantine as appropriate. Remember, these actions save lives. And now we'll take questions.
To ask a question over the phone today, you may press 1 and then 0.
We'll go ahead with the first question.
Thank you. Claudia Peshudia with KNX News Radio.
How many homeless deaths reported at this point? And also, if the state is saying it's okay to reopen malls at limited capacity and resume indoor operations at barbershops and salons, why are you not updating the county's health officer order? Thank you.
I'll let Dr. Davis answer the first part. The second part is our board will be discussing with Dr. Ferrer tomorrow the protocol moving forward. We recognize the state has allowed us to open, and we want to do it in a very thoughtful process. So tomorrow we will be discussing it and make announcements, hopefully by early afternoon. Dr. Davis in the first part.
Thanks for the question, Claudia. So we currently have 40 deaths in persons experiencing homelessness. We didn't have any new deaths reported recently, but that's where we are at the moment. Thank you.
Next question.
That'll come from the line of Colleen Shelby. Please go ahead.
thanks for taking my question. Dr. Davis, you had mentioned last week that county officials had talked to local officials about Labor Day. I'm just wondering if there's any further conversations that have come from that, any concerns that have been raised at the city level, and if LA County plans to make any updated changes this week in regards to beach access or other outdoor activities.
Good question. Dr. Davis? Yeah.
I appreciate that question. We do continue to watch our data to see what it looks like and to see if there's any increased risk. I mean, again, I do remind you that we still have widespread transmission. So we'll continue to be in discussions as we continue to move forward. We'll always continue to watch our data. Thank you.
Next question, please.
Our next question comes from the line of Ryan Carter. Your line is open.
Yes, thank you, Doctor. This is Ryan here at the Daily News. It's been reported today that the new White House public health advisor has been pushing the idea of herd immunity policy. And I wondered if you can kind of remind us where LA County Public Health stands on herd immunity. And the second question is just on schools. I wasn't fully clear about what the new state guidance means for how long schools would have to wait to reopen. Thank you.
Thank you for that question. I think the herd immunity, just to remind people, is generally when you get an infection and you have some immunity built up and are protected from that infection. Having a certain percentage of people inside of our county who have already had the infection and have that natural protection is what we're talking about in terms of herd immunity. I don't think that we have, and there's been some evidence that people can be reinfected. We've had one case inside of the U.S. That is pretty convincing that there is the possibility of being reinfected with this virus. So at this point, I think the question of herd immunity remains to be seen, and we have to continue to look at that data. In terms of schools, the waiver program is still available to us. It is also still available, the guidance related to small cohorting of schools. And all of that, again, will be discussed with our board as we think about where we are with cases and what we will need to do moving forward. But in general, what I will say that when you're in a tier related to the tiered framework that the state has put out, you're intended to be in that tier for at least 3 weeks before you can change. And that is, again, to see how your data changes as you move forward with any changes inside of your jurisdiction, but really to pay attention to what's happening and be able to adjust as needed. Thank you. One more question, please.
We'll go to the line of Jackie Fortier. Please go ahead.
Go ahead, Jackie.
Hi. Dr. Davis, you said enforcement at workplaces was one of the reasons that cases have decreased. Do you think that there should be fines levied against people who don't wear masks in public in LA County, especially coming up with the holiday weekend? Do you think mask enforcement should be stricter in public spaces?
It's a good question, and I think one of the things in all of this is we're not going to enforce or fine our way out of this. I do think that when people really understand why they're wearing a face covering, which is really to protect others, because you don't know if you're going to have the virus or if you do have the virus and can transmit to others. So I think the more that we talk with people, the more that we see evidence, and we have over the course of this pandemic, that face coverings do help. We hope that more people take that up. There are some jurisdictions in some cities that have taken to that. So I think this is a jurisdiction by jurisdiction discussion, in terms of moving forward in that way. But the really is that people just need to do it, and it is something that is protective of all of us. Thank you. Now we'll move to remarks in Spanish. Thank you.
Buenas tardes. Gracias por acompañarnos hoy. Queremos hablar con ustedes sobre el nuevo marco de referencia que...
And we continue to always bring you the very latest here on News Now from Fox. We're going to go out to get you an update in Connecticut right now. We're going to go out to Connecticut right here on News Now from Fox.
mainly those provocateurs, those folks who try and come in and create a confrontation. I think you've seen that in Kenosha. Thankfully, so far, Connecticut is at peace.
The Associated Press.
Thanks, Max. Governor, I'm sorry, I had some technical issues too. I couldn't hear your answers to the emergency order. Can you explain what was the thinking in terms of why you need to have those powers extended, and what will change, if anything?
First of all, I didn't want all those emergency orders to come to an end on September 9th, and you have a big rush in terms of what stores open and what bars stay closed and the such. We thought it was better for continuity to extend that a longer period of time. You know, Senator Fasano had recommended 4 months. Somebody else in the leadership said, let's take it out another month just so we have a month under our belt in terms of the legislature being in session. We don't have to rush to make any judgments. So that's why I think we all agreed that 5 months was a more appropriate period of time. And the 5 months, again, Sue, you know, gives our team the flexibility to move quickly if situations change. And I think that's what we learned was so important back in April, May, and June.
Yeah. And I'll just add this, Sue. So just from a process standpoint, so we will go through the process of filing this emergency renewal and declaration tomorrow afternoon. That will provide the legislature, the Committee of 10, the ability, if they would like to review that, and they can have 72 hours to either take no action or take an action of disapproval. As the governor stated, September 9th would have been a day of pure disruption in the state of Connecticut, and it would have made the state of Connecticut not as safe as it is today. Pure and simple, and that's why the governor's was moving forward to take the steps to take these actions to renew the emergency declaration.
Thanks for that. And Governor, given what happened at that Norwich nursing home, is there any move or any thinking on your part to rescind the civil immunity for nursing homes, given what happened there? That's something that AARP has called for, I know. Yeah.
Not right now, but look, we've got sanctions, we've got penalties, we've got financial penalties, we relicense these folks, so, you know, I've got plenty of leverage there, let's put it that way, Sue, but that's the type of thing we revisit under our emergency powers all the time.
And one other quick question, are there any thoughts about using federal coronavirus money or maybe other state money for another round of bridge loans for small businesses?
Not yet. I mean, our COVID relief money is pretty well targeted. Obviously, we're doing more for education in schools than really any other state right now. And then our next biggest piece is testing. So I've got to be pretty careful there. And also, when it comes to those bridge loans, I do believe that at some point the Senate and the House are going to get their minds in one place, and I know that bridge loans and additional PPP is sort of unanimous on both sides of the aisle. It's something important to do because there are a fair number of businesses that just aren't allowed to open yet. Those bigger indoor entertainment venues, bars, so these folks need some help. Even the restaurants at 50% capacity indoors. So we do think they deserve a second opportunity, and looking forward to that coming from the feds.
From the feds, okay. Thank you very much.
The Waterbury Republican American. Hearst, Connecticut Media. The Hartford Courant.
Hey everyone, this is Emily Brindley from The Courant. So the first question, I wanted to ask about last week's uptick in cases. Just wondering what your guys' reaction is to that, and if you can tell me a little bit about whether or not you're concerned about that.
I'll start, then Josh help me out. I think we've been traveling for 3 months in a very narrow band between 0.5% and 1.2%. And I know we spend a lot of time talking about a flare-up at a nursing home, a flare-up at UConn, a flare-up in Danbury. It gives us a sense that, oh my gosh, maybe things are slipping in the wrong direction. And I got to confess, I get these numbers every day, and I always hold my breath as Josh brings them in. And right now, I just feel like we're in a pretty good position. As I've said before, I feel very confident, Christine, about what we're doing at K through 8. I think the hybrid in the high schools, especially those busier high schools, makes some sense. I'm watching the universities just because they're bringing in kids from a wide orbit. And so far, we're about 2 weeks into that process, so it's a little early to tell. But right now, I'm feeling relatively confident.
Yeah, and I think, as you've seen, Emily, some of the increase in cases is a result of a significant increase in testing that's ramped up over the last several weeks as well. There's a lot of additional testing occurring based on our focused testing strategy on at-risk populations, but also with back to school. A lot of our colleges and universities are doing a lot of additional testing as they bring students back. So, as the governor said, the test positivity rate has remained very stable over a very extended period of time. So I think we're catching more of the cases with positive tests that have probably been out there for some time. The other key metrics to take note of is the hospitalizations, right? That is the real moment of truth of how many people are getting truly sick out there in the community. And we're at or close to our lowest levels of COVID-related hospitalizations we've been at since this began. The number of new COVID hospital admissions is at the lowest 7-day rolling average we've ever been at right now. So as the governor said, I think we're stable, but we're watching very carefully every day these hot spots and moving quickly to try to contain them.
Okay, fair enough. And kind of a similar question, over the weekend, Danbury still had dozens more new cases. So can you kind of square that for me with your feeling that the hotspot there has been contained? Because I heard you saying earlier that you feel like it's under control, but there are still a lot more new cases being reported there. So can you talk about that?
Want to take that?
Yeah, I think as the governor said, we're clearly not out of the woods. I think the metrics show that we've flooded in a lot of additional testing to Danbury. As you would hope to see when you bring in a lot of additional testing, the positivity rate has gone down. That's a good sign that it's not getting worse. But we do need to keep the measures in place that the mayor, in partnership with local health department and our state public health department and our colleges and our DEEP with the actions at the boat launch, et cetera. We need to keep those in place longer because even at 3.4% over the last 7 days, that's still much too high, right? We want to get that back down or near or under 1%, and that's the goal.
And last question for Dr. Carver. Can you talk to me a bit about any concerns that you have for your district, being a neighbor to Danbury? Do you have any concerns about that outbreak spreading into your district or affecting your school year?
So we've been closely monitoring with our local Department of Public Health official the impact that Danbury has had, because as you know, we are a neighbor to Danbury. And thus far, we are not seeing the spike coming into Bethel specifically. As the governor mentioned, we do get weekly data from the Department of Public Health by county. And then again, we certainly consult with our local health officials and are constantly keeping an eye on that.
Thank you. Appreciate it.
Connecticut Public Media.
Good afternoon. Concerning Three Rivers Nursing Home, did any of the staff that ended up becoming positive, were they tested and then during the period between being tested and getting their results entered the nursing home and were positive?
Yes.
And following that, do you think you're going to change the policy or the way they're tested to fix that problem in the future?
The nursing home testing that we've been doing is regular, it's repetitive, it's across the board, and as you can see in the other 211 nursing homes in the state of Connecticut, it's been extremely effective. We've driven COVID almost entirely out of the vast majority of the nursing homes in this state based on the testing protocol. So when it's followed correctly and it's partnered with all of the other important precautions that our Department of Public Health has put out there, particularly with regards to proper use of PPE PPE and cohorting of infected patients, the current formula seems to work very well. So we just need our nursing homes, as the vast majority of them have been doing very effectively, to follow those guidelines and follow those rules, and we can keep our nursing home staff and residents safe.
Thank you.
I should just add, too, as Commissioner Gifford mentioned last week, we are continuing to refine and actually expand that testing protocol, too. So now even nursing homes that have tested completely negative for 14 days, we're still going to continue some surveillance testing of the staff, about 25% on average per week going forward, just to continue to keep our finger on the pulse of infections in those communities and make sure we stamp them out quickly if we see any more.
The Connecticut Mirror.
Governor, the minimum wage is scheduled to go up $1 tomorrow. There has been some complaints that small businesses are not set up to accept that right now. On the other hand, of course, we have a lot of low-wage workers who have been on the front lines of fighting COVID. So what's your view today about whether or not raising the minimum wage is still good public policy at this point?
I'm more convinced of that than ever, Paz. A lot of people are reluctant to get back to work, and there are a lot of frontline workers who were essential workers who worked, and a lot of them were earning the minimum wage. And a lot of them were, bagging your groceries or providing food, or some of them working in daycare. And I think I'm proud of the fact that Connecticut recognizes that, and they're going to give them a $1 an hour raise starting tomorrow.
Thank you.
CT News Junkie.
Thanks, Max. Governor, are we confident that as we go back to school, there seems to be a shortage of laptops for students, and most districts are doing hybrid learning? Can we guarantee that all the students have laptops that need laptops?
Well, words like highly confident guarantee are a little risky, I think, in this environment. I can tell you we got 120,000 laptops. We spent more on technology per capita than any state in the country. We worked really hard, Nick Simmons did, in terms of extending Wi-Fi, getting thousands of discount internet lines to homes that didn't have it. We solicited, going back well over a month now, anybody that thought they may need that support, get that support. What really worries me is we had a lot of people that had laptops that had internet access last time who never logged on. So that's something I think we've got to work hard on. Christine, for those 5,000 or 500 folks that aren't getting or are going to go with distance learning, how do we make sure they actually take advantage of that? I know you're doing it on a synchronous basis, which means you're going to be integrated into the classroom. How do you make it work?
So yes, Governor, we are doing synchronous learning as part of our overall strategy for students that are on distance learning or in the hybrid during that short transition that we have at the beginning of school year. So we were very proactive in securing Chromebooks for all of our students, and we can monitor on a daily basis who's logging in to them, and that's also supported by other programs that we have in district that can monitor them in. And then if we are finding that students, and we had a very small percentage that didn't, that's where we utilize our social workers, our school counselors, our school psychologists, our classroom teachers to really reach out to families and to identify why they're not engaging, and then come up with specific strategies to ensure that they do engage in their learning. Sometimes it is connectivity, and we make sure that they have hotspots or access to devices. Sometimes it's simply if you have several students in the home that are all running Zoom or Google Meets at the same time, making sure that the capacity for streaming is there. So, but the schools take a very proactive approach in meeting with families and identifying the reasons and ensuring that we get our students on.
And my next question is for Josh. Josh, are there any nursing homes right now that, I know that there was an executive order that limited the testing for staff, that said you don't have to continue testing staff if you reach a certain threshold. I think it was like 14 days without a positive test. Are there any nursing homes that fall into that category right now?
Yeah, dozens. In the rule, just to be clear, is that you have to have 14 days, no positive test results of staff or residents. I get you the exact number, Christine, but I think it's actually the majority of the homes in the state have approached that threshold now.
Is that something that should continue, given that we do have this outbreak at this home?
Well, as the governor mentioned earlier, this case at Three Rivers seems to be a very isolated case as a result of not complying with a number of best practices around infection control, wearing a PPE, and so forth. So we don't view this as grounds to make wholesale changes to the policy. I think to the contrary, what we see in most of the homes in the state is when you follow the policies, you do the testing that the state's providing, use PPE properly, that we can control COVID.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Sorry about my technical inabilities there. Governor, could we go back to last week when the CIAC decided that they know more about the health of athletes than the Department of Public Health? I think we reporters failed to ask what kind of repercussions the CIAC might be facing in their refusal to abide by the DPH guidelines on volleyball and football in the fall.
Yeah, I'm going to go slow on that, Ken, in this sense. Deirdre in Public Health and Scott Gottlieb and Zeke Emanuel and Dr. Coe, they've all said, look, I think indoor volleyball and football, which is close contact, is probably the highest risk sport you can do. And they frown upon it and they discouraged it and said, why don't you put it off to the spring? That said, the CIAC, as far as I can understand, they're doing practice in narrow cohorts right now, so they're going to limit the nature of the spread. The practice is going to go on for another few weeks. We'll have a chance to see what COVID looks like by mid-September and be able to make a good considered judgment then. I don't think we have to jump ahead of that. And as I've said before, CIAC did the right thing back last March, under considerable heat, I would say, when they said it's not going to work for basketball. So let's give it a little time.
And Governor, when was the last time you got an update on the finances of the state hospitals? Generally, can you give me a picture of what that looks like?
I can tell you that the state hospitals, performed brilliantly during this pandemic, and where there was a pretty competitive environment between us and them, and amongst themselves, worked together as one. They took a hit, no question about it. When there's a lot less of that elective surgery going on, quote unquote elective surgery, meaning non-urgent surgery, that hit their bottom line. Different hospitals have been impacted in different ways. Melissa McCaw runs finances, is put in place right now, I believe it's $75 million out of our COVID relief fund, at least to help out those hospitals most in need. And in the meantime, we continue to work with our congressional delegation in terms of what other support there will be for our hospitals going forward.
Thank you.
All right, well, I just say the June 30 numbers have come and gone. We're getting a lot of analysis from Moody's and Barron's. Long term, let's face it, we still have fiscal challenges, which I'm not going to understate. Near term, we got a pretty good report card that now it's closer to 86% of our economy is back up compared to pre-COVID. That puts us, really in the top tier of states out there. We've done pretty well on the unemployment. That puts us average or above average. What's the difference? That we had a lot of people knocked out in the service sector there. I love the fact where we are in terms of our COVID metrics. I think you ought to be all taking a look at Bethel. This is a great school system with a great superintendent. They're opening cautiously, a place your kid can get back into the classroom, see his or her friends, see his or her classmates in the very near term, and showing that I think if we proceed with caution, we can get it done together. Thanks, everybody. Thanks, Christine.
say? He goes, Mike Buckus is crazy on me. They're saying that I agreed to all this. We just said that if the governor puts forth an emergency declaration, that said 4 months would be fine. He's freaking out.
Did I say something different?
No. You didn't say anything different. I think the only thing that you said.
That's the update there. In Connecticut, as we continue to always bring you the very latest here on News Now from Fox, bringing it to you uninterrupted right here. We're going to go back out to Governor of Florida making his remarks.
Look, the state of Florida has sent tens of millions of pieces of PPE, from face masks to face shields to gloves to gowns. When the hospitals needed more remdesivir, we were able to go and work with the task force and get expedited shipments into the state of Florida. Unfortunately, our hospital traffic had picked up. We needed to expedite that. So we were able to do huge shipments of remdesivir. When there was a need for more convalescent plasma, we went out and asked for blood donations. And in our antibody sites, we encourage people, if they test positive for antibodies, to turn around and give blood. A lot of the emphasis in March was not overwhelming hospitals, and the focus was really a lot on the number of beds. I think what we found in Florida is we had enough beds. That was never going to be an issue. You were potentially going to have stresses on the staff. Part of it is just because it's a very stressful time. Part of it is because some of the staff had to isolate as the community prevalence of the disease increased. That's the staff's a reflection of society. You were going to see more and more of that. So we sent over 2,000 medical personnel across the state, many in South Florida, but also some elsewhere, to be able to buttress those efforts. And I think that was something that was very, very important. We also, because we had these COVID-only nursing facilities, hospital was able to take a resident of a long-term care facility who was COVID positive but medically stable and didn't need additional medical care. They had a safe place to discharge them. We would not allow hospitals to discharge COVID positive patients back into the long-term care facilities from the beginning, because obviously that creates a hazard. But if you have this COVID-only unit where you could do that at a facility, then that's something that's obviously safe. So that was something that was important. And then when we came into June, in the middle of June, getting that third week, fourth week, you start to see the prevalence increase. There's a lot of people that were clamoring, saying, "Oh, it's going to be a surge. You got to stop elective procedures at hospitals." And I think there were some areas of the country that may have done that. I think the experience in March and April doing that showed that that's not what you wanted to do. So we did not do that in Florida. We basically told the hospitals, we said, you understand how to manage your patient load. And so if you look at like a Jackson Memorial down in Miami, they were kind of the focal point of the most intense increase in patients. So they dialed back accordingly, made sure they had enough cushion, made sure they had enough staff. And we obviously supplemented that. There were other major health systems that never had to do anything with elective surgeries or elective procedures. And that, I think, has worked so much better. These procedures matter. I mean, the amount of, and Dr. Atlas can talk about this, the amount of missed health care or people who have not gone in when they've needed to certain things is dramatic throughout the country. So we wanted to avoid that, and I think we were able to do that by allowing the elective procedures and stressing to people, if you have problems aside from COVID, this is a safe place to come. If you need to go to the ED for heart or stroke, make sure you're doing that. And then the third thing that we were focused on was just keeping society functioning. The idea that somehow you can just shut everything down, hide, and then it goes away, we know that's not how it works. It's not like a hurricane. You can hunker down, it passes, you come out. So we knew that we had to just keep society functioning. So we did that throughout June, July, and August. Last month, we added 75,000 private sector jobs in the face of, the height of the outbreak. In fact, I think Disney opened right as the infections had peaked, I think a few days before our ED visits peaked. But ever since they've opened, you've continued to see a downward trend, which is good. We've kept gyms, beaches, restaurants, hotels, theme parks, youth activities, sports open and operating. And I think that that's important to do. And I think that we understand, I think, a little bit better now the importance of having society function. Part of that is having K through 12 and universities open and available for folks. And so Dr. Atlas and I are going to be going to the University of South Florida after this. Dr. Nelson and everybody at UF, I think, has done a very good job of, you're going to have 50-some thousand students return. Many, I think they're here now. How do you approach that? And I think that they've been very thoughtful about doing it. But having parents have the option to provide in-person instruction if they're K through 12, and also giving the parents who want remote learning for their child the ability to do that as well. And then certainly having universities functioning. I mean, a university is a much lower risk environment when you have a lot of young, healthy people. When the universities closed with the start in March, at the start of the pandemic, you're taking people in a relatively low risk environment and then spreading them across the country where they're probably in higher risk environments. And so I think people have learned a lot of lessons from that. So our universities are open. They're going to continue to function.